All right. Boom.
Approve.
Good morning.
Okay. Oh, I had too many screens now.
Nice.
All right. Good morning, everyone. Today I'm gonna talk a little bit about intra-articular ozone therapy in horses. This started because I had an interesting case that I'm gonna share with you guys, and I wanted to explore a little bit more about ozone therapy and if it could have a role in septic arthritis. And the reason why is because I have a second. There we go. This case, our friend Dolce, he's a 14 years old thoroughbred gelding.
Oh, we don't see it.
Oh, okay.
We're not.
Never mind.
Oh.
1 second. But you see that?
Nope.
Oh, okay. Technical issues. This is my face.
Go to share.
I think I had to share a screen too.
Share that one. Yep. Click, double click. Perfect.
Okay.
Nice.
All right. So, cambio de diapositiva, parece.
Perfect.
Yes.
Mm-hmm.
All right. So this is our friend Dolce. He's a 14 years old thoroughbred gelding who is an eventing horse and low lever jumper. He was presented for with an acute left front lameness that started on mid-May 2026. It was like a bone fracture, and the suspensory injury / rupture was suspected by the rough bed. Persistent severe lameness, and it was presented for a second opinion 2.5 months later. When he came to us, he was like this. I apologize in advance to the Zoom audience that maybe the video is going to be in slow motion, but you might be able to see the severity of the lameness. I can describe what we are seeing. It's a 4 out of 5 left front lameness, minimal weight bearing, reluctant to go forward. It was hard to take him close to the treatment room because he didn't even want to go into the treatment room. He's a big guy, and as you can tell, he was not happy. Owner was very concerned because she didn't know what was going on, and she didn't see any progress in these last 2.5 months. So this is the clinical exam. The vital parameters were within normal limits. It was minimal weight bearing in that left front, markedly reluctant to walk, and he had moderate diffuse distal limb edema. So first thing we did, take some x-rays, and we could see our MC2 fracture in there. So we could confirm the diagnosis made by the ref vet, but we continue exploring because I wasn't sure. I mean, I was sure that that was not the cause of that severe lameness on that left front. So next x-rays, I started to see this. Moderate bone remodeling in proximal P1 involving part of the articular surface. Maybe a little bit of reduce of joint space there, but the main thing is all this bone remodeling and this dark lucency at the center and proximal P1 that you can see it in all, where we can see a focal lucency at the sagittal groove of proximal P1 with a lot of bone remodeling. This was not present 2 months ago or 2.5 months ago when the refit took x-rays. The owner showed to me and they were not there. And it had these little 2 dots in there. And that started to raise my concern that we have something going on, one, in the fedlock joint, and second, in the structures that attach in this area. So continue exploring. Well, the findings, as I said, we confirmed the fracture, the osseous remodeling on proximal P1, and that's focal subchondral lucency involving the sagittal groove of proximal P1. We also have mild proximal sesame irregularity and chronic reactive osseous changes around the fedlock. So ultrasound revealed that we could see the fracture there, and that branch is not very happy. Continue exploring, you can see the remodeling of proximal P1 in here. And this all soft tissue could be probably some of the obliques kind of not very happy there with very heterogeneous architecture and echogenicity. And maybe some fiber disruption there, but not 100% sure. Here the expert says it's an artifact. So yeah, at that point I was like, is it? Is it not? However, continue exploring, seeing all this bone remodeling, and I started to see some stuff at this part of the joint. So I started to focus my attention on the joint itself. Here where it should be anechoic fluid, rising even more my suspicion of a septic processing here. In all the views, these are the lateral pouch of the fedlock joint, dorsal as well. So basically findings, normal SDFT and DDFT, suspensory ligament, the proximal and body, straight distal sesamoidean ligament was okay, abnormal, the obliques were irregular, the medial branch of the suspensory ligament as well, suspected collateral ligament injury, but wasn't sure, and the moderate fedlock effusion with that echogenic synovial content, the synovitis, and capsular thickening. Blood work revealed an SAA of 1800, and white blood cells were within normal limits, but near to the lower end. So let's plan something. I wanted to confirm that we were dealing with a septic arthritis. So my plan to the owner was to reduce inflammation as much as possible in order to get the synovial fluid sample safely, and empirically start treating the main suspected diagnosis, which was septic arthritis. So I started him on broader spectrum antibiotics with Nexel, 1 gram IV twice a day, gentamicin IV once, Banamine twice a day. I started with regional perfusions. The thing here was the owner had a limited budget, and so this was all I could do in order to get a sample and to think what to do next. So I could do 3 regionals. He came on a Tuesday. We did the 3 regionals in a row. The 2 days were with amikacin, and the last one I did imipenem. He got cold water spa daily, twice a day. We sweat rapid daily, and I started him on ozone therapy IV. The swelling went down. Here during the regional, the swelling went down. I started to focalize just only on the fedlock. When he came in, was from proximal metacarpus all the way down to mid-pastern. So we made so much progress. We could get him into the treatment room, as you can see. And the leg started to look better. Like you could still see some swelling, but this was after 2 days of treatment. So he improved significantly. and his comfort as well. This was day 3. He's still walking with a deficit, but he improved significantly at day 3. So the hope was increasing day by day that we could probably make it based on the severity and the chronicity of this process. So with this is another video of him walking. So he improved a lot. So we continued to do the arthrocentesis. I did it ultrasound guided to make sure I could get into that pocket. I had to use a 16 gauge needle. There was no way to get any drop from all that thick fluid, maybe. It didn't look like a fluid. It was all kind of solid. I got a tiny bit of sample, and I was hoping, and I went to the lab and begged them to run it because I couldn't have enough to do a culture, so at least to do a cytology so we could confirm the diagnosis. And I put 1 gram of amikacin afterwards, and the cytology confirmed our septic process with a total protein of 8.4, moderate white blood cells, and numerous red blood cells, heavy cellular debris, and heavy bacteria, intracellular and extracellular. Which I was not surprised, but I had an answer to give to the owner. So now what? So as a recap, I consulted with the surgeon. That's like, hey, do you think at this point there's any benefit to put this horse on a surgical lavage and try to lavage as much as possible? I wasn't sure. I didn't think so. The surgeon also told me, I don't think so either. The infection, since we saw that X-ray and that lucency in the sagittal groove, it might be sitting in there, which is not possible to access to that spot surgically unless we break the whole joint in two, which is not the point. And maybe at that time to debride, if this infection is there, how much is going to be as a benefit, since also the owner did not have the founds. So the SAA, I did another recheck at day 4 and it's still on 1800, even though he improved significantly clinically. So we have some pros and cons in there. So I talked to the owner. Also, when I did the arthrocentesis, I checked the cartilage was okay. So there were some like very severe process, very chronic, but there are some good stuff that it could be a good indicative that he can make it. The surgeon was a little more hopeful than I was, but I had to tell the client. These are the treatment options that I offered to the owner. So the one that we've been going on is established treatment, which is continue with systemic antibiotics, do local antimicrobial therapy with intra-articular injections, continue doing systemic IV ozone therapy, joint lavage. If I could make some of that all nastiness become more fluid, and maybe as a surgeon recommendation, he said probably in a week or so, if we can put this SA, make that SA go down a little more, it might be worth to try and go in and lavage. My second option for her was to do all of that, but adding HBOT, hyperbaric oxygen therapy and continue with regional imperfusion with antibiotics. And then I offer her also doing some intra-articular ozone and some regional imperfusion with ozone as an investigational or research option. So basically, what she chose, none. So she wanted to take the horse home. I begged her to at least take her with oral antibiotics. And apparently, she had a bad emergency with her dog. She spent so much money with her dog. I know.
So for dogs, always the
Always dogs. Dogs first. Apparently almost died. Had to enucleate the eye, and she was like, I cannot. So even I talked to her about taking with meds for Profesora Yanira Figueroa.
Yeah.
I told her to take her with antibiotics for a month, and she refused to that. So it's like at least 15 days. I say, well, maybe. So we were thinking could also help to control the infection. That's what my question is like. We don't know yet. There are not too many studies, and there are none studies published about septic arthritis treatment with ozone. So this is how I got my first horse in the US. I ended up adopting him to try. I offered this to the owner. I said, like, I want to give him another chance and see if ozone therapy it's um it's an option in these kind of cases. The owner agreed.
Keep going, keep going.
Oh, yeah, continue because I have there. So the owner finally told me that yeah, I could keep him, and she was happy that she can help to the veterinary medicine world and also give the horse another chance. So we need to find this out with my friend Dolce and I started to do some research. And so the first article that I sent you guys is the ozone therapy in veterinary medicine. This is a review. It's was published in 2020. But basically, it's go through the different like what ozone is and how can we apply it in veterinary medicine. Basically, ozone is a triatomic form of oxygen. As a medical ozone is administered in an ozone oxygen mixture. Therapeutically, it can be administered systemically or locally. So systemically, it's called ozonated autohemotherapy, and locally in a mixture as a gas in oxygen, ozone, or it could be ozonated water or ozonated oils. Why is ozone biologically interesting? Because it has antimicrobial properties. So it causes a direct oxidative damage to microorganisms. Although it's a potent oxidant, the control exposure can stimulate to endogenous antioxidant mechanisms. We're gonna go a little bit farther with this. So it's kind of a paradox of the ozone. Also has an immunomodulatory effect, which is gonna modulate or do modulation of the immune signaling. This is quite interesting because it's gonna have effect on the immune mediators and inflammatory mediators, causing also an anti-inflammatory effect. But these effects are dose dependent. So it's important to follow a dose because you can cause some damage. So this is the ozone paradox that I kind of briefly mentioned before. So a controlled oxygen exposure, because ozone is a powerful oxidant, and ozone reacts with unsaturated fatty acids, and it's going to generate molecules including hydrogen peroxide and lipid oxidation products. And at an appropriate exposure, this will activate the NRF2, which this is the most important molecule that is gonna. This is the master or the boss of the antioxidant effect in the body, our bodies, and everyone being living. So this is what is going to activate, and this is going to promote endogenous antioxidant defense, including the superoxide dismutase, the glutathione peroxidase catalase, and the HO1. So the ozone is not an antioxidant itself, but it is an oxidant that at control exposure may trigger an adaptive antioxidant response. Make sense? So the antimicrobial mechanism, basically ozone produces the oxidation of bacterial surface components affecting the phospholipids, proteins, peptidoglycans, and lipopolysaccharides. What all that do, it creates a membrane disruption, because all those are the components of the membrane of the bacteria, which is going to increase the permeability. It's going to cause the cellular injury, lysis. It's going to kill the bacteria. It's going to create damage to the bacterial nucleic acids. And this is very interesting to me, especially on Dolce's case, because it's going to cause a potential disruption of bacterial biofilm. Biofilm is when all those bacteria start to create a matrix, which is very hard to deal with, just with antibiotics or even with debridement. Like, it's a layer of bacteria hard to penetrate by other substances. So this can make a difference on his case, but this effect is proven in vitro. So the evidence in these kind of cases is not existing yet. Also, the immunomodulatory effect, as we were talking, the controlled oxidative stimulus generate these oxidative products that act as signaling molecules within the immune cells. It has a potential modulation of cytokines, leukocytes, macrophages. So, but can we safely put ozone inside the joint? That was my next question. And I found this article that is in joints. There are clinical and laboratorial aspects. This was a study made in Brazil, Sao Paulo, in 2022. And basically, the objective of this study was to verify whether the transient inflammatory reaction induced by intra-articular medical ozone administration affect joint components. Oxidative substances are biomarkers, the extracellular matrix degradation. They did a study on 14 horses with two different groups, one with ozone, group A with 20 the oxygen only injected joints as control. So there were three. And each group was